First of all, I would like to ask questions which were asked today on 12th December. Whatever question asked by AMC, I'll ask from you. Today, first of all, a good news. Yesterday, I posted one testimonial of one student, and luckily today he got selected in interview, and he has sent his questions also. So I'll be starting from his questions only, whatever asked from him. Okay. First question is newborn care when child is not breathing. Okay, tell about pulmonary edema.
Pulmonary edema, it is either the cause due to in the lungs or due to in the cardiac causes. If there is increased pressure in the heart or right atrial hypertrophy or pressure increases inside the heart, if mitral regurgitation, etc., then the pressure in the heart will increases, and due to back pressure, the pulmonary pressure will also raise, and it will cause pulmonary edema. Mainly, we give mannitol or diuretics in this case.
Okay. WHO health definition. What WHO is given?
Health definition. Okay, sir. The definition of health is it is a state of physical, mental, and social well-being, and it is not merely a case of absence of disease.
Okay. What is live vaccines?
Live vaccine. In live vaccine, we are given the inactivated antibody, and the body will recognize in and produce the antigen against this. And if it is like a secondary immune system response, the example of live vaccinations given are BCG, Japanese encephalitis, pentavalent vaccines, measles rubella vaccine.
Tell about hemophilia.
Hemophilia, it is due to there are two types, hemophilia A and B. It is due to the deficiency of the factor 8. There will be spontaneous bleeding in the body, and if there is any even a little wound can goes to massive bleeding, and patient will goes to in a stage of shock.
Next question was on triage system in warfare. So in triage, mostly it becomes opposite.
Okay, sir, I know. Commonly, the triad system consists of 4 colors. The red for the emergency people, then yellow for the urgent needed patients, and green for ambulatory patient, and black for moribund or dead person. Normally, we are giving priority to the people with the red, which are rise to the red category. They need urgent surgery. Then yellow needs surgery, but it can be postponed to a certain time, or 2 to 10 hours we can postpone the surgery. Green are ambulatory patients, and they are only minor traumas are there. But in case of RB or in case of soldiers, we are give priority to the green category.
Yes.
That is reversal of the normal triage, right, so that they can make better and go for the war.
Wonderful. Even triage I have explained everybody, regarding war also in simple way. Okay, next question which were asked today on 12th of December. Acute pancreatitis with LFT.
Acute pancreatitis, it is the inflammation of the pancreas. It is a reversible in nature. But if it happens in recurrent times, then it will changes to chronic, and it is irreversible. Normally the patient present with acute abdomen, and the pain starts from the epigastrium and it is radiating to the back, and the patient will show a bending forward nature to decrease the pain. And in LFT, when we notice in case of LFT or investigation, the serum lipase and serum amylase level will increase. Serum lipase is most specific in case of acute pancreatitis. Then LDH level will also increase.
Okay. And then there is a question of T2DM.
It is type 2 diabetes mellitus. And the most common cause is hereditary or any other associated with any other illness. The patient have a blood glucose level of more than a fasting glucose level of more than 126 and random glucose level more than 200. We can claim that's diabetes. And if the patient is more than 140 more than 200 milligram per deciliter, we can start oral hypoglycemic agents. Then weight reduction, regular exercise, etc. also can make a big change in the blood glucose level.
Next question was ARV.
ARV, it is anti-rabies vaccination.
Okay.
Rabies vaccination. Okay. When a dog bite, it can be categorized into three. That is, if it is a minor bite, or category 1 involves the licking or just touching the animal, if there is no need for vaccination or treatment required for this. Then category 2, there will be minor scratches in the body. And for this, we should give anti-rabies vaccination.
Okay.
In category 3.
I know you will tell the site also and the discussion with everything. I'll tell you the topics
Okay, sir.
about discuss with you. One is calories in pregnancy. How many calories are required? And then gunshot injury. Then VVM.
Vaccine while monitoring. Okay, sir.
2-3 days back also this question was asked. Vaccine while monitor. NIS.
National Immunization Schedule. Okay, sir. Sir,
These
I am
questions
not.
were asked by board 3.
Okay, sir.
Okay, now again, tonsillitis, malaria, anemia, hookworm infections. Tell about this, hookworm infections.
Hookworm infections.
Infections.
Infection. It is caused by Ankylostomia duodenale. The most common cause is when we walk through the garden or in the soil barefooted, we can get the worm that penetrate through the bare skin. And the most common manifestations are anemia. Then patient will go to malnutrition state, then bleeding, etc. For this treatment goes to giving albendazole 400 milligram. It needs 2 doses. First, we should give in 1 day, and after 2 weeks, we should repeat the dose, so that when we first eating the drug, it will control the number of bacteria, protozoa or hookworm. Then, when repeating the dose, then we are actually killing the upcoming larvae also.
Okay, one more question. Bone marrow aspiration indication.
Bone marrow aspiration indication is acute lymphoid leukemia. Then I will check it out, sir.
Okay, please check it out.
It will give myelodysplasias, etc.
Okay. Next question. Today only. Hobbies and all those, why AMC, these are very common. Low back ache. Tell about this.
Low backache, it may due to various aspects. If the patient is more than 60 female, then the most common cause will be osteoporosis. There will mineral density will decreases after the menopause age. Then it can be also due to spondylosis, then scoliosis, the increase in curvature of the back, then can be due to gynecological causes such as pelvic inflammatory disease, then due to fibroid, due to
Okay.
fibroid growth,
Hematuria.
hemat, yeah, normally there will no red blood cells in the urine, but hematuria is a condition in which the presence of red cell corpuscles in the urine. The most common cause will be renal calculate renal stones. It will when it is small in size, it will make puncture in the urethra and causes bleeding into the urine. Then any cancer, any tumors in the kidney also cause hematuria. Then bleeding manifestation of hemophilia, then dengue fever can also cause hematuria in the urine.
Okay. RIF pain in males other than appendicitis.
Criteria for something. Males. It may be due to volvulus can cause right iliac fossa pain. Then any okay. Right renal calculate or there is UTI can cause pain. Then any abdominal perforations and peritonitis can lead to pain in that area.
Okay, okay.
Okay.
OPC poisoning.
Organophosphorus poison. Okay. It is due to intake of organophosphorus substance. Most commonly available are the fertilizers, and the patient will present with dizziness, increase in salivation salivation, urination, sweating, etc. The secretions will increases. The heart rate will increase. The people will be in comatose. Pinpoint pupils are there. And first, when the patient comes, we should maintain the conservative way, that is airway, breathing circulation should be made. Well, then the drug of choice is oxines. Sir, it is not audible, sir.
What are the symptoms of organophosphates?
Okay, it includes the pinpoint pupil, that heart rate will increases, then
Saliva,
increase in
tear production, diarrhea,
saliva,
vomiting, sweating, muscle
urination.
tremors, confusion, and all this. Okay. Next, about atropine.
Atropine is given when there is decrease in heart rate below 40 per minute. We give atropine to increase. So I
OPC,
can hear.
OPC compounds.
Phosphorus compounds. I think it is sarin chloromalonate. I will check it, sir.
Okay. Are organic chemicals derived from phosphoric acids and its derivative and contain at least one carbon phosphorus bond?
So once more, sir.
About organophosphorus compounds are organic chemicals derived from phosphoric acids and its derivatives and contain at least one carbon phosphorus bond.
Okay.
The pentavalent types of phosphorus containing compounds are primarily used in industrial and environmental applications. But we must have some names also, okay? Compound examples, yes. What I'm asking is, now I'll give you the examples. Parathione and diazinon, phosphate, and malathione, methylparathione. These are the compounds they're asking, I think as if. These are organophosphate pesticides. So these are only they're asking, if they're asking the compounds.
There is a classification, sir. I know, but I forgot. I will check
Okay,
it.
okay, go through it. It's not compulsory they'll ask, but just okay. Tell about integrated vector management.
Integrated vector management, it is mainly for 5 diseases such as malaria, dengue, chikungunya, then lymphatic filariasis and Kala ulcer. These 5 diseases are mosquito borne and it is to control these diseases. The malaria, it is spread by Plasmodium species, such as plasma. There are about 4 types of Plasmodium falciparum, Plasmodium vivax, Plasmodium malariae, and Plasmodium ovale. And it is spread by Mansonian mosquitoes. Then the patient present with the fever with chills, night chills, where night sweats, then weight loss will be there. The treatment is for Plasmodium falciparum. We give chloroquine and for Plasmodium malaria we give artemisinin based
Artemether.
artemether
Yes, yes.
based
Okay, okay. Let it be.
combination.
How to differentiate between hernia and hydrocele?
Hernia and hydrocele, both of them are present as a lump. Then cuff impulse is present only in hernia, not in hydrocele. And there is also specific tests such as ring invagination test uh, for hernia. In hydrocele, it is actually the fluid filled in the scrotum. It is transluminant in nature. When we show a torchlight into the hydrocele, it will transmit that light.
Okay.
But in case of hernia, it is opaque in nature. It not transmit light.
Okay, more questions I think will be very common, like acute pancreatitis, pain abdomen, and difference between perseverance and incident.
Perseverance and incidence. Okay, the incidence is the number of people that get the disease, and prevalence is the total number of people that is having the disease.
Next is Cules, Aedes, Anopheles. Name of mosquitoes.
Yes, sir.
What is Cules?
Culex mosquito, it causes
Cules.
the Culex mosquito, Japanese encephalitis.
Okay. So about
Grown,
these three
about
mosquitoes.
mosquito.
Yes, sir. They might be asking about the disease and all this.
They grow in Culex mosquito grow in it is also known as nuisance mosquito grown in dirty water.
Okay.
But in case of Aedes, it is grown in stagnant water, but pure water, stagnant water. In Mansonian mosquitoes, they are in live in aquatic plants.
Okay.
Inside the plants, they are living.
Anterior fontanelle.
Anterior fundamental. Sorry, sir. I
Okay.
don't.
High risk pregnancy.
High risk pregnancy. Okay. The patient with in more than 35 years, then who are obese and BMI greater than 30, then the height less than 140 centimeter, then patient with any cardiac diseases such as is a septal defect, etc., which causes Eisenmenger syndrome, the vascular septal defect.
Okay, about anterior fontanelle, it forms through the juxtaposition of the frontal bones and parietal bones with a superior sagittal sinus coursing beneath it.
Okay.
Okay. Anterior fontanelle. High risk pregnancy. And the next question is water purification. I think we should go this topic. I have already told many times. Water purification strategy.
Water purification strategy, it is by chlorination. We can
Go through this topic nicely.
purify.
We should cover this topic. Okay, what is Colles fracture?
Okay, Colles fracture. It is the fracture of the radius. It is the distal 1/3 and medial 2/3 of the radius is get fractured, and the hand will be in slightly deviated to the ulnar side.
There are other topics like types of hepatitis, virus causing hepatitis, water disinfection methods, disinfectation methods, treatment of TB, health definition by WHO. This question is asked many times. Even I asked one boy yesterday, and today this question again came in final interview. I think these questions were from 11th of December. Examples of live vaccines, we already discussed live vaccines, vaccination schedule. All these questions, I think, was of 11th of December. I have already discussed few questions with you of 12th December. Okay. Okay, now come on the video call.